Good day everyone. This is a pre-recorded video for the specific learning objective of the gross anatomy of back. Kindly read recommended book pages and listen my pre-recorded video, then prepare the learning objectives for the flipped class session. You can see these are the three learning objectives I have chosen for this particular flipped class session. Simple learning objectives. The required reading from the chapter 4, these are all the pages, very limited pages. From this chapter 6, only one page, 417. Now we will discuss first two objectives. Totally we have only three learning objectives to be discussed for this particular flipped class session. First one is identify the structure of the intervertebral disc. Then differentiate the joints and ligaments of the vertebral column in terms of their location. I have quoted the pages. You need to read only these pages. First we will discuss about the intervertebral disc. Then we will move on to the joints of the vertebral column. The intervertebral disc, what we are going to talk about, this is the one. We have 21 intervertebral discs in our body for 31 vertebrae. It is made up of white fibrocartilage. When we need it, the intervertebral disc provides or allows movements in the vertebral column and acts as the shock absorber. Where movements are possible, the movements particularly in the cervical and the lumbar region. At the same time, the intervertebral discs are thicker in those regions. Structurally, the intervertebral disc has two parts. The peripheral or outer portion called annulus fibrosus. The central portion it is called nucleus pulposus. The annulus fibrosus thickens with age, but it is vascular throughout the life, supplied by the peripheral blood vessels. But when you talk about the nucleus pulposus, located more posteriorly, avascular. The nutrition through diffusion process from blood vessels, but dehydrate with age. That's all about the structure of the intervertebral disc. Now coming to the joints of the vertebral column. Before going to discuss about the joints of the vertebral column, you must know about the parts of the vertebrae and what are the joints. So the parts of the vertebrae I will be teaching you in the didactic lecture. But even though, let me quickly summarize. Any vertebrae you take will have the body and vertebral arch. The vertebral arch, you will have spinous process, transverse process with superior and inferior facets. So spinous process, transverse process, pedicel, superior, inferior facets, they are all considered of the vertebral arch. Then vertebral body. This is the vertebral body and this is considered of the vertebral arch, the lateral view. Now, between the vertebral bodies, we have the joint that is called intervertebral joint. That is through intervertebral disc. That is secondary cartilaginous joint. It's the first joint. Then, between the superior and inferior facets, the joint is called facet joints or zygapophyseal joints. That is between the facets. Then third one, craniovertebral joints. The name itself, the cranio between the skull and the vertebrae. That is atlanto-occipital joint. We know that the occipital bone of the skull and atlas, first vertebra. Between them, we have that particular joint. The atlanto-occipital which permits flexion and extension movement in the neck. S movement. Then we have between first and second cervical vertebra. First cervical vertebra name is atlas, second one is axis. So that is called atlantoaxial. Atlantoaxial, this is the joint. This atlantoaxial joint allows rotation movement. That is called no movement. So we have right and left atlantoaxial joint, both the side. Along the midline we have median atlantoaxial joint. So between first cervical vertebra and second cervical vertebra we have three joints. Either side, right and left atlantoaxial joints, midline, median atlantoaxial joint. So we have some ligaments. They are transverse ligament, alar ligament, tectorial membrane. They are all attached with that. So atlantoaxial allows rotation movement, that is no movement. Atlanto-occipital allow flexion and extension movement, that is S movement. Forgot to tell about zygapophyseal facet joints, which allows gliding movements. Then next one, costovertebral joints. We know that costo means rib and vertebra, between the rib and the vertebral columns. So the head of the rib articulates with the body, that is costovertebral joint. Also we have costotransverse joint, that is the transverse process of the vertebrae will articulate with the rib. This is the facet for that. Costotransverse joint. Then with the rib, head of the rib with the body, costovertebral joints. Then in the lower portion we have sacroiliac joint. The 2.5 piece or 3 piece of the sacrum body will articulate with the iliac bone of the hip, forms the sacroiliac joint posteriorly. So the sacrum posterior either side, which articulates with the ilium of the hip bone to form right and left sacroiliac joints. So these are the joints of the vertebral column. Quickly I summarize. Between the bodies of the vertebra, intervertebral joints. Between the facets we have facetal joints, which permits gliding movements. And craniovertebral joints between the atlanto-occipital, atlantoaxial. So occipital bone and atlas. Then atlas and axis. So we have these two joints. Then costovertebral and costotransverse joint, sacroiliac joint. These are all the joints of the vertebral column. Now we are going to discuss about the ligaments of vertebral column. What are the ligaments are supporting the vertebral column? Anterior and posterior longitudinal ligaments, ligamentum flava, interspinous and intertransverse ligament, supraspinous ligament. Then in the neck region, the upper ligaments, whatever I quoted, they are all throughout the length of the vertebral column. But in the neck region, we have nuchal ligament, transverse and alar ligament, tectorial membrane. They are specific for the neck region. Now, one by one. The anterior longitudinal ligament. It is situated anterior and lateral aspect of the vertebral body, anterior and lateral aspect of the vertebral body, and intervertebral disc. So throughout the entire length of vertebral column, you have that particular ligament. What's the main function? Very simple, which will limits the extension. You can see here when the neck is going to bend backside, this anterior longitudinal ligament is going to be stretched. It means which limits the extension. Now coming to the posterior longitudinal ligament. The posterior longitudinal ligament will be located along the posterior aspect of the vertebral body. It will be running here. entire length from C2 vertebra to below entire length, not in C1, which limits the hyperflexion. So from C2 to entire length, but anterior longitudinal ligament throughout the length, but above C2, that particular posterior longitudinal ligament is called as tectorial membrane. What we are talking about in the neck region is the tectorial membrane. Now quickly anterior and posterior longitudinal ligament, let me summarize. Anterior longitudinal ligament along the anterior lateral surface of the entire vertebral column, but posterior longitudinal ligament along the posterior aspect of the vertebral body, leaving C1. So from C2 to entire length below, but above C2, that posterior longitudinal ligament is called tectorial membrane. So anterior longitudinal ligament limits the extension, but posterior longitudinal ligament limits the hyperflexion. Now coming to the ligamentum flava. This is the ligamentum flava. You can see here. The ligamentum flava is between the lamina of the vertebral column, between the two lamina, which resists the separation of the lamina and flexion. So it resists the separation of the lamina and flexion. That's all about it. It runs throughout. Now interspinous ligament. The name itself, it is between the two spinous process. You can see here is the interspinous, between the two spinous process. Intertransverse ligament. It is also between the two transverse process, either say lateral aspect. Supraspinous, tip of the spinous process to the, this is the supraspinous. You can see here tips of the spinous process, that is supraspinous. Above in the neck region, that supraspinous ligament is called as ligamentum nuchae, that is nuchal ligament. Once again I summarize these portion other than anterior and posterior longitudinal ligament. We have ligamentum flava between the lamina. See here, this one between the lamina. Then interspinous ligament between the spinous process. Then intertransverse ligament between the transverse process, but the tips of the spinous process are attached by supraspinous ligament. The supraspinous ligament in the neck region, it is called nuchal ligament. That is called nuchal ligament. So the nuchal ligament or supraspinous ligament is below, but the same supraspinous ligament in the neck region we call it as a nuchal ligament. Strong fibroelastic tissue is present. It gives attachment for the neck muscles. That's quite important. So you must know the different names. Same ligament, what we talked about in the posterior longitudinal ligament from above C2, that is called tectorial membrane. The supraspinous ligament in the thoracic and lumbar region, when it comes to the cervical region, it is called nuchal ligament. And it is made up of strong fibroelastic tissue, gives attachment for the muscles. Then between the first and second vertebrae we have some ligament, that is called transverse ligament. What is called transverse ligament, that is on the atlas. This is the transverse ligament. Can you make out? This is the transverse ligament, which separates the dense or odontoid process of the axis vertebra from the canal for the spinal cord. That's the transverse ligament. In case of hanging, this transverse ligament will cut and odontoid process will move forward and it will compress the spinal cord and medulla oblongata. The patient will die. So important ligament, that's a transverse ligament. The axis we have one more ligament, that is called alar ligament. Okay, that is called alar ligament. We talked about already about the tectorial membrane. So that's all about all the ligaments. So anterior posterior ligament, what is the function? The ligamentum flava between the lamina, interspinous and intertransverse between the spinous process and the transverse process, supraspinous It is between the tips of the all the supraspinous spinous process except in the neck region, that is called ligamentum nuchae or nuchal ligament. Then we have specific ligaments for the atlas and axis, transverse ligament and alar ligament. These are all the ligaments of the vertebral column. You must know that. That's all the summary. Now we are going to discuss the last objective, that is identify the muscles, innervations and actions of the back. I have mentioned these are the page numbers. Now we are going to discuss about muscles of the back. In case of the muscles of the back, you need to know only name, nerve supply, action. You don't have to know about origin and insertion now, because some of the muscles of the back you will study when you do upper limb and lower limb. So it has got two category major groups, extrinsic and intrinsic group. This is the extrinsic group what you see here. The extrinsic group has superficial and intermediate. Intrinsic group is called as deep. The extrinsic group of the muscle helps in control of limb movement and also accessory muscles of respiration. The intrinsic muscles which we are going to study later, that is going to control vertebral column movements and posture. Now we will talk about the extrinsic muscles. What are they? The extrinsic muscle and superficial group has trapezius. You can see here, this is the trapezius muscle. Then latissimus dorsi, this is the latissimus dorsi. Levator scapulae, you can find this is the levator scapulae. Rhomboides major and minor, this is rhomboides major and minor. This is considered to be the superficial group. You can see clearly trapezius, latissimus dorsi. If you take out the trapezius and latissimus dorsi, then you will find levator scapulae, rhomboides major and rhomboides minor. All these muscles are attached to the appendicular skeleton. It is going to attach to the scapula and the humerus. Now can you see that when you reflect the trapezius, you will find a triangle area that's called triangle of auscultation at 6th intercostal space, because when you use the stethoscope for lung auscultation, you will have any intervening muscles. You don't have any intervening muscles, so the stent directly lies on the rib cage and you can hear the breath sounds. That's called triangle of auscultation. Where is it located? In the 6th intercostal space. So that's all about these muscles' name. Now you must know something about the nerve supply and action. The actions you will study when you do the upper limb, but the nerve supply mainly by the cervical plexus for the trapezius for sensory, but the motor supply to the trapezius is by spinal accessory, spinal part of the 11th radial nerve. When you talk about the latissimus dorsi, nerve to latissimus dorsi, the nerve coming from the brachial plexus. The cervical plexus I told you, that's for the levator scapulae. The rhomboides major and minor, it's by levator scapulae, all of them by nerve to rhomboides. That's all about the nerve supply. Coming to the intermediate group, we have serratus posterior and serratus inferior. It's quite deeper. That's all about the extrinsic muscles. You should know the names on triangle of auscultation. Where is it? Special test of the trapezius muscle, because very often while sleeping we may get muscle spasm, that is the trapezius muscle spasm. Which nerve supply? That is spinal part of the accessory nerve supplies the trapezius. When there is a nerve injury in the neck region, the trapezius is going to be paralyzed. So how do you test? Shrugging of the shoulder is the typical action of the trapezius. If you ask the patient to shrug the shoulder on the affected side, he may not be able to rise. That is a test for the trapezius muscle. Now, I will move on to the intrinsic muscles of the back. Now, we are going to discuss about intrinsic muscles of the back. Intrinsic muscles of the back are arranged in the form of superficial, intermediate, and deep. In the superficial set, we have splenius, that is splenius capitis and splenius cervicis. In the intermediate group of the intrinsic muscle, we have erector spinae. This erector spinae has three parts. You can see here three parts: spinalis thoracis, longissimus, and iliocostalis. These are the three parts, medial to lateral. It is extending throughout the length of the vertebral column, starting from pelvis up to the thoracic and cervical region. But splenius capitis and splenius cervicalis, you will find it from thoracic to the neck region, occipital. Now, deep set, transversospinalis, that is here. It has got transversospinalis. Then we have this way semispinalis and multifidus. You can see the multifidus, semispinalis capitis, thoracis, all of them. Just you must know the names alone. So deep set. So we have superficially splenius, intermediate erector spine. It has got again three parts. Then transversospinalis deep. It has got semispinalis and multifidus. All these intrinsic muscles, already I told you, is going to control vertebral column movement and posture. They permit vertebral column flexion, extension, lateral bending, and rotational movement. Now, what you see here is the overall summary and the muscles responsible for each movement in the vertebral column. If you have a time, please kindly go through them. You don't have to remember everything at present. The purpose of doing this one, studying these particular muscles of the back, to understand the muscle strain. If you have a muscle strain in the back, which muscle is involved, where is the problem? You must be able to differentiate. That's why. Thank you so much. Kindly be prepared when you come to the flipped class session so that we can discuss further. Thank you so much. Bye.